We're going to call the Board of Health meeting for Wednesday, February 19th to order. Have to read the following, since this is still a hybrid meeting. It means that we can do both in person and remote with Zoom, which is why we have people on the screen. So the legal background for this is pursuant to Chapter 2 of the Acts of 2023, an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law on March 29th, 2023. This meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but may be watched when the show is replayed on YouTube. Members of the public wish to participate in the meeting may do so in the following manner: in person at the Roe Park Meeting Room on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass. Note that the occupancy limit of the room may reduce the number of attendees that can be accommodated. You can also access the meeting using Zoom. There is a link to the meeting ID and the passcode on the agendas. So first thing we have to do, first thing is really important. I want to welcome back Erin. Hi, Erin. Can you hear us okay? Yes. And also, welcome certainly to Madison. This is your first meeting with us. Can you hear us okay also, Madison? Okay. So the first thing we have to do tonight, we have member missing and our alternate is missing, but we have a form. We have to approve minutes from both January 8th and from December 4th. So I don't know if everyone was present for both of those meetings. Do you? So we have to do them separately. Okay.
I'm looking at the 12/4/24 meetings and they say January 8th. Am I the only one that's having that already?
I'm looking at the January 8th meeting, which I printed out from Daniel.
Right. It says December 4th, but it comes out as January 9th.
Oh, so they're both January 8th?
Both same, okay.
All right, so let's just approve January 8th then, and we will have to go back. We'll have to revisit December 4th. Okay.
Does anyone have any changes? That includes Lorenzo, who's online with us, or corrections to the January 8th minutes?
No, they're both very accurate.
No,
Lorenzo, any changes to the minutes from January 8th?
no changes.
Okay. Dr. Reed? You're going to just abstain? I believe officially you can actually vote on this, if you wish to.
Yeah.
But you could either abstain or vote, either way. Okay.
Mhm.
And I have nothing.
Okay.
So we'll just call the roll.
I'll make a motion to accept.
Well, sorry, we have to do the vote.
Yeah, I'll make a motion to accept.
And, Lorenzo, would you second that, please? Lorenzo,
Yes,
could you just second the motion that Amy just made?
yes, seconded.
Okay. Then we'll just call the roll. Lorenzo, yes or no?
Yes,
Amy, yes or no?
Yes.
Dr. Reed? Abstaining? Myself, yes. So there's one abstention and there's 3 positive votes to approve. And I guess the 12/4 minutes are going to be redone from that meeting.
Mhm.
So the next thing is one of the nicer things we ever have to do. Erin's already been through this. She came to a couple meetings in person, and the last one I think was remote. Madison, welcome to the Board of Health. We certainly appreciate you agreeing to do this and taking the time to join us. I'm going to ask the board members who are here to introduce themselves to you just by name, so you can see our faces and associate the names. And also what sort of backgrounds we have and how long we've been with the Board of Health. Amy?
Hi, my name is Amy Palmer. I am the health director for the town of Mansfield. I've been on the Board of Health for 4 years, and then I was on the Board of Health for 5 years when I first moved to Plymouth in the early 2000s.
Dr. Reed?
Terry Reed, I'm the vice chair of the board, and I've been on the board, I think, for about 4 years as well. I'm a pediatrician.
And Lorenzo?
Hi, welcome. It's always great to see young folks on the engage with public health. My name is Lorenzo Pizarro. I've been on the board for a few years now, and I love being involved in civics. So, welcome.
And I'm Gary Clinton. I have a doctoral degree in genetics, and I taught public health for longer than I care to remember as an undergraduate faculty member. I've been on the board. This is now my 7th year, I believe. The first year or so, I think I spent as a vice chair. And then, as is usually the case, when the existing chair left, I became the chair. We've been doing this for quite some time. We're really the first, I think, in Plymouth to incorporate having student representatives from the schools. And we're certainly happy to have you here with us. Going to ask you a few questions towards the end of the meeting, but if you have any items that you think you would like to have discussed by the Board of Health, at the very end of the agenda, you'll see it says request for upcoming meeting agenda items. And I also got a few general questions for you because we've heard about some things from Aaron. We'd like to get your opinion also, obviously. So welcome, and would you please now introduce yourself and give us some background information about where you are, courses you're in, outside hobbies and interests you have, extracurriculars, whatever you want to share with us.
Yeah, of course. So my name's Madison. Hi, everyone. I'm a junior at Plymouth North High School, and I'm enrolled in the Biomed and the Allied Health program there. And towards the end in May, hopefully I'll be getting my CNA certification, and we'll be doing the state testing with that. I'm also involved in other like health activities. I'm in the Medical Careers Club, and this is my first year doing that now, and also my first year I'm now in the National Honor Society. So I've been doing lots of volunteering around our community, and I'm just super excited to be here. My goal for like the future is to go to college after I graduate high school and then hopefully medical school. And I think someone else mentioned that they were a pediatrician. That's always been like a big goal of mine, is to become a doctor and work with children. So yeah.
That's great.
Do you have some hobbies you'd like to tell us about?
Most of my hobbies, I love like hanging out with my friends and listening to music. I go to lots of concerts and I love to travel. I've been to a bunch of different countries now, and yeah, I love to like explore, see new things.
Okay. Thanks, Madison.
Thank you.
I also didn't mention, but that might be of interest to you. I was the pre-medical advisor for the university where I used to work as a faculty member for 6 years. And so I have a lot of background in that area. I'd be more than happy if you have any questions about how you go about applications to help out anybody that would like to get a second, third, fourth. I don't know how, obviously, usually that happens when you're in college. Not when you're in high school, but I'm always happy to provide information beforehand. And I'm sure Dr. Reed would be happy to give you a little encouragement as well. Thanks a lot.
Thank you.
Um,
周日的话是几点到几点？11点半到9点半。
someone else is talking.
Look at unmute. That's that.
Okay. So I should also probably point out that the legal ability to have hybrid meetings officially ends the end of March.
Really?
But
That was an interesting warning.
I inquired, of course, of our new local senator, Massachusetts State Senator,
Yeah.
and I said, you know, this would be quite a big problem for us. Is this going to be something that the legislature is going to take action on? They're, oh yes, I'm sure that they will. And then I found out the governor had inserted a lengthy extension, or actually a permanent extension of the ability to have hybrid meetings into another bill, which is going before the state legislature. Hopefully this one and the next meeting in March will not be the last ones.
I hope not. I mean, not just for us, for all the meetings that we're having.
Yeah,
Yeah,
it could be a bit of a problem.
wow, okay,
Just a heads up,
yeah,
because the legislature does have a tendency to not do things
all right on
on time,
that.
as we all know. So, with that, I'd like to ask Mark, because you've got
Kevin.
two.
Kevin.
How is it Kevin? How is Kevin?
Every now and then Mark surprises us.
What does Mark do with us other than?
Still working.
He's actually kind of here, thank you.
Hello, folks.
Hi, Mark.
Can also share the screen, so, it's probably better if we do that, because Lorenzo is remote too. Okay?
Yeah.
Okay, so, Kevin Flaherty from Flaherty and Stefan, representing Eugene Lane at 69 Pond Road. Eugene just recently bought the property, the failed septic is currently there, it's a 1,000-gallon tank, failed beach pit. So he knew he had to repair it and bring up to Title V standards as soon as he bought the property. We're asking for a local upgrade approval from neighbors well over here, from 100 to 72 feet, as well as just due to the topography, depth local upgrade variance from 36 inches down to 72 inches. So really what we're trying to do for this 4-bedroom house is just bring it up to code. So as you can see, you know, their well is all the way up here, so we had it come in the backyard anyways. And the topography is such where it kind of drops down to the backyard before it goes up this hill or then rolls back down. The existing wood line is right here, right across this back here. So really what we try to do is keep the new Title V system in the same location as the existing leach pit. Obviously, a 10x40 system is bigger than a 6-foot diameter pit. So it just kind of stretched across that space a little bit more. So the existing leach pit is about 90 feet, which is right in here from their well. Just with the expanse of this, you know, we're forcing it 72. So as you can see here, this is the 100-foot radius from their well. So really, to make this a conforming system, we have to bring about 6 to 8 foot trench all the way back through this wooded area, put it all the way back, kind of adjacent to where their house is back over this. We kind of thought that this, from a usability standpoint, this was somewhat of the best option for what we could do on the spot. And full disclosure, I think the contractor had a miscommunication. They started backfilling, they pumped the existing pit, and we're starting to begin work about last week. The neighbors had called the Board of Health, and they reached out to us and kind of put a stop to that right away. They did drop off the components that were proposed in this plan, but again, there was a miscommunication on their end about whether they had a job or whether they had a permit type thing offices. That's kind of where things are at right now, but there was a little bit of initiation before they jumped in. But with that, I'll be happy to answer any questions.
I think on some of the paperwork, it does say there's a cesspool.
Yeah, I think there was must have just been a typo. But yeah, there is an existing 1,000-gallon pit right underneath the step right here. 1,000-gallon tank. Back that way.
A little confused. There was a septic system and it was failed.
It was when he bought the property with, I think it was a cash buy, they knew it was a failed system to bring this standard.
Okay, thank you. Then was the department recommendation?
I'm just gonna ask first before that, is there somebody in the audience who wants to speak about that? Okay.
Yeah, my name is Carol.
If you want to come up to the table and then just introduce yourself, please, and thank you.
My name is Carolyn Cleveland, actually, I'm a real estate agent, and I've been friends with Luann since high school. I sold them the house 10 years ago, this is their forever home. And I have a couple of questions to begin with. Now you just mentioned, and I kind of assume, what is Ms. Luann's intention for this property?
That doesn't matter.
All I know is that he's upgrading the septic. It's a single family lot, but it's a septic repair.
Yeah, it doesn't, that doesn't matter. Not in this particular audience.
Yeah, this is
they're primary residents, and obviously, you know, they have a concern for the potability of their drinking water in the future. And also, you know, should they decide to sell, any potential,
Okay, well, let me hopefully, eliminate some fears. The state of Massachusetts says that your well needs to be 50 feet away from your soil absorption system. So they already have that. So the state of Massachusetts says, okay, you go ahead. But the town of Plymouth says, you know what? We want to take a look at anyone that's between 51 and 100, just to get an idea of what might be happening there. That's why they're here today. They'd be approved by the state of Massachusetts, but we do a little closer look. And that's why we're taking a look at that. So as far as sellability or anything like that, there wouldn't be an issue.
and then, it did, confer with an attorney, but unfortunately, he had a commitment today. So couldn't be here, but he's gave us a couple of questions to ask as well. Are there any other situations in town that this has happened? And if
I'm
so-
at a bazillion.
Okay. And are there any different kind of systems that can be installed or safeguards? for, like,
Not in a
well,
particular location, no. No. No, this is, and to be honest with you, the neighbors that you're representing, I would think they would want this system before they would want a failed system. Because a failed system is gonna present much more of an issue to them than this system ever would.
Well, I guess that's what I'm saying.
Yeah, I mean, I'm just being honest,
Right.
because what they had before had the potential to leach away from that area and to go into other areas. This system stops that from happening. So it took what could have been a potential problem and solved it. So to summarize, the department would approve, and to let you know as well, the department would approve this.
Yeah, our concern, you know, is usually with well water, especially if there used to be a cesspool present. So as Kevin knows, whenever someone comes before us and wants to do an upgrade or repair, if there's a cesspool present, we always encourage well water testing to be done. I'm not sure that that's necessary here because there is a existing septic system, even though, you know, I suppose a failed septic system could also cause a problem with wells, especially on
So
the front.
typically, we would test our well if it was within 100 feet. So kind of laws and legalities of it, that is, if our existing wells within 100 feet of the current leach pit, soil absorption system, whatever it might be, then we would be required to test our well.
But not there.
Not that well, correct. It just, so because Title V says that there has to be a potable drinking source on site. So if their well is contaminated, then that's not the case. So
And what if their well ended up being contaminated, what? We didn't want to.
there could be variables.
Yeah.
Could be their own system that would be doing, there's a lot of variables that. But I guess what I would say is that usually it's the separation from the bottom of the system to where groundwater is. The leach pit is definitely much deeper than where our system is. So if our system sits up and, you know, the top of the system is maybe 3 feet, I think it's 4 feet below grade on the plan. The bottom of that system is over 2 feet below. So then you're 6 feet below grade. That pit is probably about an 8-foot pit. I don't know that for sure. But the 6-foot diameter pit, the way you've got it volume is. So the bottom of that leach pit where the LDF is going to the ground would be much lower, or would be not much lower, but lower than the system. Would be my kind of reassurance anyway.
And I guess my last question too, I believe the letter said a 3-bedroom system, you just mentioned 4-bedroom?
It's an existing 4-bedroom house. I think there was, there might have been a scrivener error as well, but it's an existing 4-bedroom house for accessors and for walk.
Okay.
So that's what we're doing 4-bedroom.
Okay.
And it will have a new tank too. It's the old 1,000-gallon tank is not conforming, so we'll have a new.
Bottom line is, this will be a lot safer for the wells, plural, than what's there now. If
Yeah,
that's,
my original concern was that when the guy came out and was long tape measure, he said it was really required 100 feet, so that was just my state saying 50, he said, you guys are taking that extra step That solved a lot of the issues.
We always encourage everybody who has a private well to at least one time run some tests on it to make sure that it's safe, because you don't know what was there before. Even on your properties, I mean, you might have had cesspools there too. And, you know, it's always better to know what it is you're drinking. But there's obviously no legal obligation for the people that are the subject property to pay for that, you know, additional test on your well.
Getting that well testing.
We actually encourage people, because of the fact that there's some nasty chemical called PFAS that in other areas of the state has gotten into the private wells. And it's nasty. They call it a forever chemical. And if that's in your well water, it is a health risk. And most people don't test for that. It's an expensive test. We're hoping that eventually the state will decide to expand, you know, the private wells that are eligible for that. Plymouth didn't qualify because we had too many people that were on sewer. But certainly the way things are going with the PFAS and what they did test in other communities showed that there was a small percentage, but a significant percentage that did have too much PFAS in their environment.
Right.
Okay.
So.
From a public health perspective,
They ever fail. Right.
Of course, your system could fail tomorrow. There's no guarantee. I mean, there's no guarantee. What happens is that this is a brand new system. So chances are this is gonna last a little bit. But who's to say that you start flushing wipes down the toilet? You start pouring grease in your cooking with down your toilet. You have something, you have a sink in your garage and you rinse out your paint brushes that go down the sink. All of that goes to your septic system. So you may think it's going off to some magical place, never to bother anyone again. But unfortunately, it doesn't. It's going to this little operation underneath the ground, and misuse can cause, as with anything, you could misuse a car, it's gonna not last as long. You could misuse our bodies, we're not gonna last as long. So just like anything else, if you misuse your septic system, it's not gonna last as long as it probably should. But I have to say the clarities are phenomenal. And if anyone's gonna put in a Class A septic system, I'm gonna have to say, if everything I've seen, and I've been here for 12 years, that's the team that's gonna do it.
and Kevin, maybe you could also, how often do you recommend that septic systems be inspected?
So, yeah.
Well, inspected and pumped.
Inspected, they usually aren't inspected unless there's an issue or if there's a sink. Pumps, you should, you know, depending on the age of the system, you know, every year, if it's getting older, every couple of years, you know, I do mine every couple of years. That's it. Depending on the people, depending on the usage, but you know, again, as the systems get older, you want to are preventive with those to see if anything's going on.
I do mine, I say, oh my God, I haven't done one.
Well, a lot of people don't do that. They don't know, it's like, they move in the city, have to know these things.
Oh, that is, I've heard them in my office as well. Yep.
So we have an extra large tank in our backyard. Is there an extra large tank?
So you probably have a 1,500 gallon tank. I don't know when your system was put in, but if it was done after 94, it's probably a 1,500 gallon tank.
Yeah.
So you're conforming, so their tank in their backyard will be up to standard just like yours.
Okay.
Which is another benefit of, you know, them upgrading.
Okay.
All right.
But if your tank hasn't been pumped, maybe it should be. Here's a-
Maintenance. Absolutely.
Unless somebody else has questions for Kevin. Amy, you're done?
Yeah, I'll make a motion to accept the plan as.
Wait, I have to check with Lorenzo first. Lorenzo, did you have any questions?
Yeah, so there's two variances, 72 feet with this 100 feet. What was the existing leach pit that's going to be covered? Was that within the 100 feet?
It was around 90 feet.
I'm sorry, I missed that.
It was around 90 feet. It's kind of.
Oh, so So it was under 100 feet already. And then the cover, there, the second variance is 36 inches. How much cover are you doing on the leach field?
So there's gonna be 4 feet of cover because the existing pipe goes underneath the basement slab. So as the, go through the backyard, the grade comes up. So without putting a pump system in, this was, you know, that variance was required. We didn't encounter any groundwater down 12 feet. I don't expect it even lower than that. But when we did the test pit, there was no groundwater. We got at 12 feet.
Okay, so it's going to be less than 36 inches is what you're saying.
So the top of the field is gonna be, I think it's 4.5 feet down.
72 inches.
Okay,
All right, so the finished grade is gonna be around 78.5, and the top of the field's gonna be 74. So a little over 4 feet, but we're deeper than that 3 feet of cover. So we have to ask for that little.
And that's just adding.
Okay.
That's all that is, an H20 system adding a vent.
okay. No further questions. Thanks.
Okay, thank you, Lorenzo. Anything else? No. I don't have anything else either. Are there any other abutters present other than those who already have spoken? Okay, in that case, now you may go ahead with the motion.
The motion's made.
Raises made. Just needs a second. Okay.
Motion's been made and seconded by Dr. Reed. Again, I'll just call the roll. Lorenzo, yes or no?
Yes.
Amy?
Yes.
Dr. Reed? Yes, it's unanimous of the 4 members present.
You make any notation or absent? I'll just leave it blank. Okay.
Thank you.
Thank you, everyone.
Stay warm.
Thank you.
Stay warm. Okay, Kevin, don't go too far.
Okay. Plus, Mark has got to be the second one. Oh, the flip side.
So Kevin Flanagan from Players Pond, 27 Central Ave, down by the Big Sandy Pond. They are going to be knocking down their existing house and moving forward with kind of a new house in the same location, a little bit farther away from the wetland buffers and everything like that, which is more exposed to the street. So we're asking for a couple different local area approvals. We're asking for a setback reduction from 10 feet to 5 feet to the property line here. We're asking for a local upgrade approval from 100 to 62 to this corner here, as well as setback from our proposed level from 100 down to 70 feet from this new location over here. So really, it's an existing 3-bedroom house. They're gonna go back with a new three-bedroom house. We try and keep everything as kind of tight as here as we could. I would love to expand a little bit farther down here, but there's a well down this way that kind of cut us off right here. And the other real thing, we thought about moving it closer to the street, but from a practical standpoint, there's an overhead along the property line. So it's much easier to put on paper, but for a contractor to actually put the system in, we didn't want them underneath the wires. We hugged off that a little bit. So, I'm sorry, I forgot to mention that we're asking for a reduction from the foundation from 20 feet to 11. That's kind of the reason why we shifted it back a little bit. Again, conservation pushed us this way, power pushed us this way. We're gonna put a 40 mil barrier in between the new septic system and the foundation. And it's also getting rid of 2 septics close to the pond. Kind of the big improvement. And I think we'll probably ask for a conditional approval. They haven't put the new well in yet. So we don't have a well test, but I have to use the old well is in the existing house. So when that house goes down, the well goes down, that type of thing. So, I think we'll, once we have the approval, they were holding off until they had everything in hand. They'll put the new well in, go that way. And conservation's already approved everything. With that, I'll be happy to answer any questions.
So is there any point to testing the new well that just goes in?
So they always, when they put a
do.
new well in, they test always comes back. It's part of it, just the
Yeah.
installation process. Once they drill it, put it in, send us.
Yeah, we don't have no idea what those two existing cesspools did to the existing well.
The inside the house, they asked. House is coming down. Probably. At this point, so it's kind of where everything's at. And again, we would love to have moved our golf farther away, but the neighbor over here, we're in a small lot territory here, it's only a 12,000 square foot lot. So there's really no separation between all these, and there's separate here, so it's kind of.
Oh, go ahead, please, just a second.
Squeeze everything in as much as possible.
By now, we've discovered that you're an expert at squeezing things in. Okay, is there any butters present for this application? There was one abutter, right?
Yes, we was impacting the neighbors all over here, but we haven't heard from them, saying that, certified.
But they were notified.
They were.
Okay. Then does the department have any questions or recommendations?
No, we would recommend approval. It's a small lot, and I think that, based upon what they have to work with, that this is the best plan that could possibly be put forward.
Thank you. Lorenzo? Chris, do you think you need to take that down? Lorenzo, do you have any questions about it? No? Okay. Amy?
No.
Dr. Reed? Myself? No? So it's going to be a motion for conditional approval for request.
Yeah, I just think that again, there's can't tell you that we have well test right now, so it's.
Okay.
If that's part of the condition, this is that as soon as they actually install.
Okay. So we just need a motion to make conditional approval subject to satisfactory royalties.
I'll make that motion.
For a second. Made by Amy, seconded by Dr. Reed. Call the roll again. So yes or no?
Yes.
Amy?
Yes.
Dr. Reed?
Yes.
Myself, yes.
Thank
Four
you.
approved, one absent.
Okay.
Thank you. Until the next time. See you more than anybody.
Thanks, Kevin.
Okay, next order of business is going to be 3 different grace trap variance requests.
Yes, Portly Pilgrim, is Portly Pilgrim here? I don't think so. So I can talk about Portly Pilgrim. So the Portly Pilgrim, for those who don't know, is located at Village Landing. They requested the variance because of space, really the number one reason is space restriction. The Portly Pilgrim is only 225 square feet in size. So basically the grease traps are basically bigger than the shop. So all of the sandwiches that they serve are purchased fully cooked, so that we're not cooking anything there. They do have an electric panini press and an egg cooker, both of which have their own external grease catcher, and those are dumped into a trash can. So the sewer division approved the variance based upon small space, but they did request that instead of having the grease situation cleaned monthly, they would like to see it twice a month. Engineering said okay, as long as they increase it to twice a month. And public health also said that the grease trap is cleaned every 3 months. And to change that to every month as opposed to every 3 months. So we're gonna change if we grant the variance, we're gonna grant it based upon the increase of grease trap cleaning to every other month as opposed to every 3 months. So basically moving it 1 month closer.
I think you said something about twice a month.
Yeah.
That would be a lot. No, it's gonna be every other month as opposed to every 3 months.
Okay. I can make a motion to-
Well, wait.
Well, you see-
Then discussion. Yeah.
But if there are questions.
But that's when they're just.
Okay, but we did it both times.
No.
Lorenzo, do you have any questions?
No, I don't. Thank you.
Amy?
I don't have any questions.
Nothing.
Thank you.
Myself, no, so you hear that.
Okay, so now I'll make a motion to accept it for, with the recommendations from the health department. Every 2 months.
Okay. Is there a second? Dr. Reed seconds the motion. I'll call the roll. Lorenzo, yes or no?
Yes.
Amy?
Yes.
Dr. Reed?
Yes.
Myself, yes. Unanimous.
Great, thank you.
Next, please, Scott.
Gardenia Palace, I think, is someone here for Gardenia Palace?
Yes, I'm here.
Hello,
Hi, how are you?
good, how are you?
Good.
Do you want me to present for you, or would you like to present the reason for the variance? It's up to you.
Yes, you can help me. It's okay. Yeah.
Sure, absolutely. So Gardenia Palace is requesting their grease trap variance because basically they're not preparing food. They do not offer dairy-based drinks. There is no dishwasher at the bar, which could lead to accumulation of fats, oils, or grease. So the best practices that we're asking them to implement would be to continue training staff, to post signs that say no grease in the kitchen area to remind staff to minimize grease discharge, water temperature, dishwashing, spill prevention, maintenance, and monitoring. So the engineering division recommends the variance on the bar sink based upon the drink menu. All other required fixtures per regulation are connected to the external grease trap. So the food part is going to the external grease trap. This particular area, which is a bar sink for drinks, is not on that big external one, but they're asking if they could just continue to do what they're doing. And so plumbing, engineering, and public health all recommend approval for this particular area to have a variance on the grease trap.
Thank you, Carol. So I think the way we should do this, because we do have the owner present, is to make sure, first of all, that no one has questions for the owner. So does anyone have questions for the restaurant? No?
Yes. So I think I can. Yeah. So I think I can. Just see a little bit more about this variance. So I have like a huge grease trap at the kitchen, and so all the equipment at the kitchen are connected to the outside grease trap, and for my bar area, I will add a passive grease trap at a bar. So there will be a three sink, two hand sink, one at the beginning of the bar and another one at the end of a bar. And the middle sink, I will change it to the dump sink. And all three sinks will connect to the passive grease trap. So I will still have a grease trap at a bar. It's just not an automatic one because that one's super huge, and I would like put it very deep at the floor. So I would just add a passive grease trap at a bar, and all three sinks will connect to the passive grease trap. So to prevent, in case if there's a little bit grease will accumulate at the bar. So
Okay, thank you. Is there any further discussion? Hearing none, I'll just ask for a motion to approve.
I'll make a motion, I'll make a motion to approve the passive grease trap for the bar area.
yes.
I second that.
Okay. And I'll just call the roll once again. Lorenzo, yes or no?
Yes.
Amy?
Yes.
Dr. Reed?
Yes.
Myself, yes, it's unanimous again. Thank you for coming in.
Thank you, you're all set.
Thank you. Thank you.
And then Domino's Pizza.
Is there anyone from, oh, you're from, okay. I will put this down as you learned something new. So class and requested a grease trap variance. I laughed out loud. And I said, you're hysterical. And then upon further review, I learned that, interesting enough, there's no dishwasher. The 3-bay sink is currently connected to a passive grease trap. Pizza is cooked on pans covered with parchment paper. And all other menu items are pre-cooked. So we're recommending monthly pumping continue with the level of fats, oils, and grease that are removed. So I learned something new. I just assumed, foolishly assumed that was a big fat no.
But I thought it was the thing, and then I read your report, and I was like, wow, look at that.
No, interesting enough, it really proved the fact that we were right. We went there. And I'm like, no way, there's no way. And there is a way, and they do it. So the department would also recommend that the requested variance be approved.
I assume you've never seen something like this before.
No, I just thought pizza, cheese, oil. I was like, what? Don knows that's hysterical. But then when we took the tour and we talked about it and everything, I was like, oh, okay, well, consider the day a waste if you don't learn something new. So
And most pizza restaurants also cook other foods.
mhm,
right?
yeah,
And
true.
There's not.
They have all the fire grill,
Yeah.
so that's what the house.
It was,
And there's no eating, and there's no dishes, and it's
No,
just, yeah.
no seats. I think there's 2 tables to wait while your food's getting, if you're looking at food, like I sat there once.
Yeah,
Yeah.
I was in the same camp as you.
Oh, no,
And I was like, wow.
but very interesting.
DPW and engineering.
So sewer, when sewer went, they said they did not see any evidence of grease. They believe the monthly pumping of the passive grease trap would continue to be sufficient. Engineering approved and public health approved. So,
In that case, unless anyone has any further questions, Lorenzo, anything? Amy, Dr. Reed? In that case, I need someone to make a motion to approve. Dr. Reed makes the motion. Is there a second?
I'll second it.
Amy seconds the motion. Just call the roll. Lorenzo, yes or no?
Yes.
Amy? We're all unanimous once again. Thank you.
yeah, thanks. Oh, it was so funny.
Okay, the next item of business is the poultry regulations relinquishing to agricultural commission.
Yes, so thank you, Dr. Potvin. So a little bit of background on why we're doing this. I'm requesting that the board do this today as such. A few years ago, when people were going to the select board and complaining about roosters, they noticed that our current chair at the time was sitting in the audience, and the select board chair said, hey, why don't you do something about this? And so he did. And so that's how the poultry regulations were born and how they came through the Board of Health and the Public Health Division. At the time, we only had an agricultural committee, but now we have an agricultural commission, which does have the authority to implement and to continue with any type of rule and regulation. So in light of that, working with the planning and development department in the conservation division, working with the agricultural commission, we as the public health division are requesting that the regulations be relinquished by the Board of Health so that they can move over to the agricultural commission, working with conservation through planning and development.
Better laugh, but I have to ask this. Does that mean we'll no longer hear requests for comfort roosters?
That is 100% accurate. So any type of issue or questions or anything like that will go through first the agricultural commission, who will then work with the departments that I mentioned in order to reach a resolution. Very similar to what you folks did. If somebody came in and wanted a variance request for their rooster, or they wanted to keep more chickens, or someone was complaining or something like that. It's just moving out of our division and moving to a different division, which we deem to be more appropriate at this time because it is a commission and no longer a committee.
Which I say I'm extremely thankful. But I don't want to prejudge.
Time changes things, right? So, yes, absolutely. And of course, we'll continue to work, you know what I mean, as we work with all divisions and departments inside the town hall. So it's not like we're just like, locking our door if anyone has a question. It's just that it just makes more sense for it to, they deal with animals. You know what I mean? So let's continue to let them deal with animals and let's move the poultry regulations over to them.
And they're okay.
We have actually been working on, I should have said that at the beginning. I'm sorry, Amy. Sorry. We have been working on this for about 7 months. Yeah, yeah. No, we have been working with the Agricultural Commission. We've been working with staff here at the town hall. We've been working with our administration. So our town manager knows this is happening and everyone's good with it. Yep.
Does anyone have questions about this?
I have a question, through the chair. These poultry regulations, is it just limited to poultry, or are you saying any kind of agricultural type of regulations that we have under public health that would be relinquished and transferred over to the commission? Would we make changes to anything that's in the, like, been documented as well?
This is a regulation. It's not a bylaw. It's not following any public health law from chapter 111. So what we're talking about is a regulation that was set up by a previous Board of Health. And we're asking that the regulation be relinquished from the Board of Health so that the Agricultural Commission can take it upon them to continue with the process.
Because it's poultry, like it's our poultry regulation.
It's our poultry regulation. So chickens, yeah.
Not goats or anything. It's-
No, but they're gonna work on that too. Yeah, the Agricultural Commission will be working on things like a farm compact, how to be a good backyard farmer, goats, what else were we talking about? Llamas, the stable, but the state of Massachusetts has to stay with animal control, so that does stay through animal control, which is part of the public health division, so that will stay with us.
And I'm sure rats stay with us too.
Oh, rats will always stay with us. Why would we get rid of them?
I hate that wording, but the rats will always stay with us.
Yeah, the rats are a public health issue for sure, and they'll be staying with us.
Any other questions, or do you have anything else, Lonzo?
No, I don't. Thank you for that clarification, Karen.
Sure.
Myself, my thankful self, no. It took a lot of time when we had to deal with those requests for things like comfort boosters.
Yeah.
We need to make a motion.
I'll make a motion to move the poultry regulations to the agricultural.
Okay. There's no further discussion. I just call the roll. Lorenzo, yes or no?
Yes.
Amy?
Yes.
Dr. Reed? It's up, yes.
Thank you. Okay.
Thank you.
So I'm up for the next one too. So, through the Public Health Division, we have, private trash hauler regulations. And, it's come to my attention that the regulations do not have any indication of start times or stop times. Yeah, like when they can start and when they have to stop. So I thought they would follow along with the commercial vehicle noise ordinance, which is 7 a.m. to 7 p.m. Well, I discovered through my research that not all trash trucks are considered to be commercial vehicles. So I said, okay, well then I think what I have to do then is to come before my board and request that in our trash hauler regulations, we can add the hours of 7 a.m. to 7 p.m., which will coincide with the hours that are for commercial vehicles underneath our noise ordinance, which is a bylaw here in the town of Plymouth.
So not all the haulers are commercial vehicles. What are they?
This, just like you have had, I guess, a truck that you use for work. Pickup truck.
Private vehicle trash hauler.
So I just want to make sure that they really can't stop before 7 because we are having, having some cases where they're starting at like 5:30 in the morning. So I really think to be consistent, to do the same thing across the board, I think it's important that we have the same hours that the noise ordinance does, and that we put that inside of our private trash hauler regulations.
If you have it, say it's, no, nobody shall commence collection before 7 p.m. Did you want to put in a 7 p.m. or do you feel like that's just,
No, I want to put it 7 p.m. Yeah, sorry. Yeah, no, because the noise, the noise ordinance says 7 a.m. to 7 p.m. So I really want to be consistent with that. I want to, Okay, if we'll make that change. Yeah, I really want to be 7 a.m. Thank you, Amy. I want to be 7 a.m. to 7 p.m. So we're consistent. But really, because the noise ordinance bylaws specifically says 7 a.m. to 7 p.m. So I would like ours to say that as well. So thanks for that, Amy. We'll make that change if you folks think that's appropriate to actually have it.
Anything else? Ken, did you want to say anything? I mean, obviously, we're not voting on anything other than the change in times here.
No. That makes sense to me and goes again in the category of you learn something new. I didn't know that they were commercial vehicles.
Not all of them.
Is there a motion
I'll make a motion to accept them as written with the 7
with
p.m.
the appropriate
Yeah.
time limitations?
Yeah.
Okay, you think that? I thought you would. I'll call the roll. Lorenzo, yes or no?
Yes, if I heard correctly, 7 a.m. to 7 p.m.
Amy?
Yes.
Dr. Reed? I think yes.
Great, thanks so much. All right. Now it's going to you, Dr. Poppin.
The noise regulation also applies for other reasons like contractors,
Oh, sure.
because we live with that
Mhm.
because of massive amounts of construction going on with trucks constantly going up and down the street next to our house.
Yeah.
But we found out that they can't start doing that until after 7 a.m.
7 a.m. to 7 p.m. And now our private haulers cannot do that either.
So the next item of business for us, we're running a little bit ahead, but that's a good thing too, I guess. If you recall correctly, we did have a polystyrene food and beverage container public forum. We did gather some information from that, but not much beyond what Ken provides for us. We did, however, come up against, practical matters such as when should this new regulation take effect? And it was decided towards the end of the public forum. It made sense because of the logistics of notifying all of the restaurants about this. And to make sure they had adequate time to actually remove or utilize their existing styrofoam, polystyrene containers. That it made sense, and I looked at a bunch of other cities and towns that have done this, and they all provided the first of the year effective dates. So it's too late to do it for the first of 2025, but we can do it for the first of 2026. So that changed. The other thing that changed was simply for enforcement, where the existing regulation stated that it would be the responsibility of the health agent to inspect and enforce this regulation. Turns out, and we've heard this before many times, so we'll do something about it. Turns out that that is not doable. Because of staff limitations and time limitations, which also flow, of course, from financial limitations. So that was changed to read that compliance with this regulation shall be enforced by the health agent or the designated food restaurant inspector as part of their ongoing duties when they inspect restaurants. That I would hope would mean that our health agent would not have to be involved very much. I suppose unless there was repeated violations, which would require the Board of Health to take actions. And in that case, we would have to have a confirmation about the repeated violation.
Yeah, exactly. Yeah.
So I assume that was all acceptable to the department.
It was.
This is going forth, as I explained at the public forum, as a regulation.
Mhm.
Doesn't mean it cannot eventually become a bylaw.
Right.
But we did the same approach previously. And we generally felt that having it issue as a regulation would allow us to make any necessary changes without going through a meeting and having to go before all kinds of other committees and boards. And that once everything settles down, as it did for the short-term rental regulation, we can always send it out to the town meeting as something which has already been, put forth as a regulation, which has been working and enforced. And therefore, we thought it should now become permanent as a bylaw.
Yeah, and through the chair, I definitely agree. I always like kind of refer to a rule and regulation as sort of like the JV team and the bylaw is the varsity team. So this is a chance to kind of like work through it, see if there's any like glaring omissions or something that, we didn't quite think about or isn't really working for the town of Plymouth before we would actually put it together as a bylaw and present it to town meeting, so.
And I don't know if we have anybody from the restaurant industry.
I don't know who Mary Beth is.
Mary Beth, can you hear us?
You know who that is? No, Mary's just watching. Okay.
I've seen her on Zooming in before to our meetings.
It was just like the one. That's cool.
The Zoom user.
Yeah, they might just be watching too.
Okay.
Yeah, okay.
Well, if there's ever anyone, by the way, that wishes to make comments and you're zooming in, you'll find at the very bottom of your screen that there's a thing that says react. And if you click on the little button that says react, then a little orange hand pops up on the screen next to your name. And we can see it on the list of people who are actually participating in the
I
board.
don't know if Peter wanted, is Peter looking for it?
Oh.
I think he's looking
Peter,
for it.
are you looking to say something about this? You have to unmute yourself.
I'm fine. I'm fine with this.
Oh, okay, great.
Can you hear me?
Yes, we can.
He said he was fine with it.
Fine.
Yeah.
Do you an owner of a restaurant or represent the restaurants in Plymouth in any way?
No. He works on sustainable Plymouth. It's important. This would be important to him in his career. Yeah.
So, does anyone else have any questions or have any further discussion?
Karen, did you hear from any, did any restaurants reach out to you?
No. No, we certainly, we had our public forum, they could have certainly reached out to, the office anytime they wanted to. We put it in the newspaper twice, it's been talked about in Plymouth Independent, so, we reached out to Amy Naples, the, Chamber of Commerce, she sent out a message to everybody, so. No.
And the select board also got an announcement about it, I think, from the town manager.
Yep, and Derek talked about it, so.
We have communicated this to the best of our ability to everybody we could possibly contact. And no response, no complaints.
Yeah, and if anyone has any questions between now and January of 2026, I mean, our office obviously is here and people can certainly come by and, and share your thoughts, but. Lorenzo, Tom just hand.
Found your orange hand?
Yeah, through the chair. Karen, has the language of the regulation just been, I know we've kind of thrown it out there and reached out to people ad nauseum almost. Has the language been reviewed by Plymouth Town Council?
Right, so once the board decides they want to move ahead with this, I will give it to our town council for review. But it's very similar to what other municipalities have, so I don't see anything glaring in our regulation that stands out from what other municipalities have already done. But yes, Lorenzo, it will definitely be reviewed by town council.
Okay, thank you very much.
If there's any problem, town
I
council
will
would notify.
bring them right back to you folks. Yep, way before January 1st, 2026.
Anything else, Lorenzo?
No further questions.
We're joining 60 some odd other towns and municipalities in having this regulation because of the obvious public health hazards entailed with, polystyrene and, styrofoam containers. Anything else, Dr. Reed? No? I thought nothing. So we just need a motion to approve the regulation as presented. Yes.
Once they talk to they don't use it. We talked about this a while.
Yeah.
Yeah. So I think everybody,
Yeah, I think this is probably just gonna get maybe some of the stragglers to.
just one minute. Everybody will.
Yeah.
I have, witnessed styrofoam containers being used in some, but not many establishments.
There's a lot of better.
Yes.
And of course, we will obviously communicate with all of the food establishments prior to this being implemented, that this is happening. So should they have any questions, they can certainly come to the office if they've got any concerns that they have. January 1st of 2026. And tell them that's showing them that way.
And we also discussed as we were revising this, that when the permit renewals go out.
Yep.
They will also receive a copy of this.
Mhm.
So everybody will know. If they have a permit that's approved, they will get this.
Yeah, it's like
There
60.
are more than 60 that are. And as a matter of fact, there is a bill, I believe, pending before the state legislature at the moment.
Yeah, I think too, what helped this particular, concern is that the vendors who actually sell the product in restaurants also understood that this was an issue and started recommending other products. Yep, yep.
And there is in fact a House bill that has been presented by Michelle Kikolo. And it is an act to reduce polystyrene in the environment, which is pending before the state legislature.
Right. Yep.
Yeah, I read it. I assume it also restricts even the sale.
I think it restricts rigid as well.
Mhm.
And I think it was your, I think it's the sale in retail.
Oh, okay, that makes sense. Yeah.
Because it didn't make sense for us to go into retail because it's just Plymouth. But if the state does it, that's a difference.
Yep. Okay.
Any further comments or questions?
Lorenzo, yeah, his hand up.
Yeah, through the chair, I'd like to get some feedback or comments from our student representatives on a ban on polystyrene to see if they have anything to add to the conversation. So if you can do that through the chair.
As a matter of fact, Lorenzo, I would also like to find out what kinds of containers are used in the schools.
For the most part, it's not cardboard. It's like this. It's like a cardboard material, but I don't think we have any styrofoam at the schools anymore. I know we used to like years ago, but I haven't had like a styrofoam tray or anything in years.
So it's the same at Plymouth North.
Yeah, I agree with Erin. I haven't seen any styrofoam. The trays and like the cups now are more like they're thicker than styrofoam, similar to like the cardboard, almost like a shinier plastic kind of material, not styrofoam.
Okay. Because this regulation also does not require, but it strongly urges all food service restaurants and businesses to only provide plastic straws and utensils upon request. which we thought would be something that the restaurant industry would appreciate, because obviously that could well save them quite a bit of money. They wouldn't need as many. That's a problem that has to be worked on. Because even when you go online to order takeouts, and there's occasionally something that says, do you need plastic utensils? And you actually indicate no, you get the stuff home and you open it up and there's plastic utensils in it. So I think we'll have to
That's
do
good.
something.
Young kid who's packing your bag.
Yeah.
Said, what's a utensil? So I think,
This is the form.
yeah,
What's the
yeah,
utensil?
what's a utensil?
Yeah,
So I think that's what happened.
Straws, plastic straws, I know. There's not a ban now, right? It would. Is it?
No, this regulation will not ban it.
They went to the paper stores.
Horrible.
I mean, the straws that currently are in use, they're made of some kind of reinforced cardboard, I believe. Is that true, Ken?
Yeah, if you go to like World Cup, they have a very solid.
They do, yeah.
straw
Yeah.
That is paper, but it's not the kind of.
The complaints were that they were just collapsing as you tried to use them. Yeah.
Yeah.
But it opened up a new industry.
It was not good.
That's right, people think.
Yeah.
That's right.
Yep.
Yeah.
Yeah.
And we're bringing them to.
And the little straw brush. So now you can clean them.
The other semester is the.
Anything else you'd like to say about that?
Well, yeah, they, some research has shown that this program doesn't hit them automatically, but we see some
Yeah.
asphalt cuts down on some usage.
Mhm.
So to say yes.
I would love, yeah, I would love to not be given a straw. But
And what's the sense of getting plastic, straws and utensils when you're taking stuff home where you don't even use them? So they just go right into the trash because you can't recycle them.
There is a process.
oh,
Yeah, no slower than plastics.
Okay. So anything else? Then all we need to do is take a vote, after you make a motion.
I'll make a motion to accept the new regulation as written.
Okay? If there's no further discussion, I'll just call the roll. Yes or no?
Yes.
Amy? Dr. Reed?
Yes.
Myself, yes. Well, I guess we join the 62 other communities that have done something to try to protect the people of Plymouth from some dangerous stuff that could harm their health.
Yay. One step at a time.
Little by little.
Our restaurants. Okay.
Okay.
All right, so I'm sure by now everyone is aware of avian flu. Well, our office is certainly aware of avian flu.
Is it all over like still?
Yeah, Dana, kudos to Dana, who's answering the phone with all the questions about avian flu, and then kudos to my animal control officers who are the ones that go out and get the birds, because our policy right now is if a resident reaches out and says that they have a dead bird on their property, we go out and get it, regardless of what type of bird it is. That might have to change because we never did that before for songbirds and things like that, but with avian flu here, we are doing that here in Plymouth. So, specifically Canadian geese, swans, and other birds. However, you might hear that there are some, I shouldn't say some, we had 30 seagulls collected by the state of Massachusetts 2 weeks ago at Long Beach. Then the snow came. So now the snow is melting away, and there will be officers once the snow has gone. So we will be removing those next week out on Long Beach. The seagulls do not have avian flu. However, what the seagulls do have is lack of food and the temperature is too cold. Seagulls bury their food in the ground and then fly away and then come back and get it. And then coming back to get it, it's not there because they can't get at it. The ground is frozen. So, the state does not believe that the seagulls are dying from avian flu, but they are dying from starvation and from being cold. So we continue to monitor that. We are, putting out press releases, every week now with numbers for the week prior. Number of phone calls that we receive in public health and the animal control officers receive, and the number, we're calling them pickups, but the number of birds that are picked up by the animal control officers. So we will continue to do that. Again, we encourage people so strongly to not let their pets free roam right now, dogs, cats. Cats are very susceptible to this virus. It's really important. Also, no one should be fed raw milk or raw meat. If you do that for your cats or dogs, please do not. And I understand that people like to have their animals be free and off leash. I get it. However, one, we have a leash law, and two, that at this point in time, I certainly wouldn't want to see any domestic animals get sick or die because they picked up a bird when you didn't have them in your sight. So, again, other things to think about, the risk to humans is exceptionally low. There are no cases right now in Massachusetts. There are a couple of cases in other parts of the country. Most all people worked with poultry, and we have had one death in Louisiana. And that person was a little older, had some other health concerns, and did work directly in a poultry industry with poultry. So we're keeping track of things. We're keeping an eye on it. We're working with the state. I'm sure you know that. And we'll continue to update as we go along.
But have there been any backyard ones that you heard of?
Here in Plymouth, one. Yeah, and the owner was very honest. He called me and he said, I let them free range.
Yeah.
They leave and they come back. And so that's what happens. We don't know when they leave who they're associating with. And so when they come back, they can't tell us, hey, I was with the sick duck. So unfortunately, we don't know. And if you have a backyard flock, once one bird is tested, your entire flock must be euthanized. So that's why people are saying, well, these eggs are so expensive. And that's true, not necessarily because we're euthanizing flocks here. However, I'm talking tens of thousands of flocks in the poultry industry have had to be euthanized because it's so contagious.
Eating those eggs today.
Yes, you can still get farm fresh eggs if you'd like to. However, I would highly recommend that you wipe them off so there's no little feathers stuck on them or anything like that before you use them. And you can still have your bird feeders. Dr. Potvin asked me that, and yes, you can. However, if you go to empty your bird feeder or clean your bird feeder, I would recommend wearing gloves, because even those songbirds usually are the birds that eat from a bird feeder, and they're not right now showing any signs of having avian flu. You don't know who those songbirds have been talking to. So those songbirds could have been associating with the geese down the pond or something like that. So just safeguard and wash your hands, wear gloves, and then of course wash your hands accordingly when you are done cleaning. Also, if you have booties, I'd put them on your shoes or keep your shoes in the garage or outside.
I was also asked by someone, is it safe to eat raw eggs?
Because of bird flu or just in general?
In general, just like raw milk. And I know there's an underground group that loves raw milk. Not a really good health decision to make. I mean, I know they think it's healthier because it's not pasteurized, but it can cause problems. Yeah.
Actually had one person I knew actually packed raw eggs into a can of tomato soup, and
Yeah, I can see that. People think it's, because the Rocky movie, he cracked 7 eggs and drank it. I mean,
Everything's risk. If you crack an egg and you don't cook it, you're at risk of getting sick. Are you gonna get sick all the time?
If you eat undercooked chicken, I mean, that could be horrific. Oh, anything, yeah, yeah, whether you want to do it, yeah, if it's worth it. Respiratory illness, I'm sure we all know this too. We are being hit with all four right now. We have seen a very rare spike in flu and then a respike. Usually doesn't happen. Usually we have a spike and then we taper off. We are having another spike. So let's get vaccinated for flu and COVID. Let's stay home when we're sick. Let's use hand and respiratory hygiene. Let's wear a mask around others. I know people are definitely, I'm seeing it more and more and more in crowds, on public transportation. People are definitely wearing masks more now. Get tested for flu and COVID. Avoid crowded areas, maintain physical distance, and increase your fresh air. So, you know, it's a tough season out there. It really is. Now, flu, COVID, RSV, now we have norovirus. So a lot of things happening that we really need to, and by keeping track, we literally are keeping track. I mean, we keep track of the numbers, where they are, where it's located, are they in the schools, what are we doing? So, but for individuals, you know, always self-care. I've always said that.
Well, COVID and RSV seem to not be as big an issue right now. They have gone down from what they were originally. So, yeah, but flu compensated by way
up. Yeah, it's tough. So just a quick, also summary on our mosquito program. I'm not going to go all out of this stuff, but there are a couple of highlights. You know, we work with the Plymouth County Mosquito Control Program every year. 330 larval sites were checked. 8,908 catch basins were treated in Plymouth. Why do we do this? Because it helps prevent the emergence of any known mosquito vector, especially with West Nile virus transmission. 19,940 acres were treated using truck-mounted sprayers for control of adult mosquitoes. And 1,250 linear feet of ditches and streams to prevent overflows of stagnation were removed. And that's what we talked about too. You know, when we talked about remove your freestanding water in your backyard, wheelbarrows, little kiddie pools, things like that, they did it on a much larger, grander scale. But it's the same idea. Freestanding water is very attractive for mosquitoes.
Sustainable Plymouth at that forum here with.
Yep. Yep. Blake.
They did such a great job explaining all of that. And I mean, I've heard it a million times and I still went like, oh, I didn't know that. You know, so I feel like that was a really and to listen to to kind of dispel any fears of what are you spraying in my environment. You know, that I felt like
definitely. Yeah.
The scientific details. So they do what they do with mosquito control and the state of epidemiologist, and they just, I don't know if it's online or anything, but I was impressed. And I had to leave, like I was there for an hour and a half and I was like, I gotta go because people are still getting up to ask questions. So
I got actually one question that stated that he had heard that there is PFAS in the material that's sprayed to control the mosquitoes.
There was, and that was in the mosquito, it wasn't in the stuff that was in the spray, it was in the containers, and that was years ago, and they realized it and they stopped it.
Okay.
So
with that person listening.
yeah, I mean, it's true, but then, well, I mean, if we get on the subject of PFAS now, but like we're thinking about when they talk about the containers in schools, like takeout containers can have PFAS in them. Like on that, shiny, so anyways, not to go off.
We shouldn't go off on PFAS.
Yeah, we could be there for hours. That's okay. Speaking of grease traps, because we gave 3 variances tonight, but for those folks out there who may be interested, the Chamber of Commerce has something called the Plymouth Area 1 Fund, and they are offering restaurants who meet certain criteria, which means they have to upgrade, because we're telling them they have to upgrade, I believe it's $500, which helps. Every little bit helps. So this will be on our website. Folks can go the Plymouth Area One Fund, and they can it's Plymouth One Fund at plymouthchamber.com. And there's an application they fill out, and then it's reviewed, and then they can be issued a $500 grant from the One Fund to help with the cost of upgrading their grease trap. Public Health Excellence Grant, Devin Donovan, who is the epidemiologist that you've all met, has been incredibly busy with MAVEN investigation. And with what I'm talking about, our second wave of flu. For Public Health Division, these are the calls that I was talking about. We had 33 calls last week regarding avian flu, and 14 deceased birds were picked up. You're gonna see that number jump when we go out to Long Beach next week.
Yeah, I was up there on Friday, I didn't see anybody. So.
You can see some like caught in the seaweed a little bit. I mean, I also think that the tide comes in and might take back, you know what I mean, but may also bring some in. So I don't know if they're the same ones, but we did have a meeting about that, and we are going to take ATV vehicles out onto Long Beach and collect. And we'll also know the number, but also if there are other species that we haven't seen yet, which is also important, because we let the state, the Massachusetts Department of Agricultural Resources and Mass Wildlife know if we do come across a species that we haven't told them about yet. And that's what I have for you folks tonight.
Okay, Karen, any questions about anything presented? And the next item of business is chairperson's announcements. I think should ask Dr. Reed to also provide some more information about children who are 5 and under having unusual neurological symptoms when they become infected with flu.
Well, I don't know what the unusual symptoms were. I didn't read that.
Well,
Yeah,
yeah, Dana said something about she
well,
was
he was talking about
Legs.
legs, but he was talking about pain,
Yes.
leg pain, and you know, one of the things that can happen when you have any kind of viruses, is it can settle in joints. And the joint fluid actually becomes inflamed, then you get an arthritic appearance to some joints, and it's usually the bigger joints, so the knees, the hips, the elbows. And it's not uncommon with viral illnesses, all kinds of viral illnesses, so the flu, and this particular flu is a tough one. Maybe doing that. As far as neurologic symptoms go, I would think any kind of meningitis is caused by inflammation in the blood. And meningitis, as we know, can cause all kinds of neurologic issues. It can cause some bad ones, but I don't know what the article that you read an article about. Neurologic
just today I saw that.
Was it seizures or?
There were seizures involved,
Yeah.
yes.
I mean, that's what I would think, that it would probably have something to do with the meninges getting inflamed, just like the joint space gets inflamed. These viruses are, they don't care where they go and settle, and they'll go and settle in those areas.
For some reason, it was the children under 5 that seemed to be predominantly showing this.
Yeah. Well, and that would be common mainly because their immune systems are not as well developed.
Yeah. You think it would also show up in the much older population too. I don't know if it has or not.
You might not know arthritis.
Yeah,
Older
yeah,
people.
Yeah.
Who knows if it was caused by the food on
I know.
Peter? Peter, are you there? Is that,
It's gone.
the hand's good, the hand is on?
He's gone too.
Okay. Okay, so the only other couple of things I have to mention is, I am now a member of the handicap panel.
Yay.
And at the last meetings, they gave an update on the amount of radioactive water, wastewater that was left. It was 800 and some odd thousand gallons. And 2 months earlier, there was about 914,000 gallons. And so the evaporation apparently has caused about 47,000 gallons to disappear into our air in 2 months. Just so everybody knows what's going on. But they are pursuing, well, with the state, an appeal to get permission to dump the remaining water into Cape Cod Bay. Don't know what the outcome is going to be. If that is denied again on appeal, they are planning to take it to court. And in the midst of all this, they are utilizing the funds that were put aside, of which was like $1 billion from ratepayers for decommissioning purposes, to pay for all these legal expenses. But, in the bottom line is they're using up the money. That's for decommissioning. And whatever is left after the decommissioning process is complete, that company gets to keep. So by doing this, actually it was mentioned, I think by Kevin Twenty or by one of the people from the deep state DPH, that you'll probably have more money left if you just go ahead and pay to have this water removed to a disposal facility. Then if you continue to fight, you dump it into Cape Cod Bay and put it into the air of the people who didn't seem to make any difference there. But I want to update you on that. The other thing I need to do is the next meeting date, which is for March. The available dates are the 5th, and I guess the 19th, because it's 14 days later. I was already told there are 2 members of the board that are not available for the 19th, but are available for the 5th. So if there's no objections by the members who are currently present, I think we should probably choose the 5th, which is the first Wednesday of the month of March. Is that okay for you, Lorenzo?
Yes, it is.
Amy?
Sure.
Okay. It's okay for me. So in case you get any more septic variance requests, you can tell them that the next Board of Health meeting will be on the 5th of March. Is that okay for you?
Yeah, when are we doing the tobacco?
Well, the tobacco thing, if that went out already
It did,
as a public notice,
yes.
then a portion of that meeting on the 5th will be devoted to a public forum on
Okay.
on the tobacco regulation change. So that it does include sublingual pouches, which by the way are not made from tobacco. They are made from synthetic nicotine.
No. Okay.
And that's why our current tobacco regulations, and in fact, the state tobacco regulations do not cover the pouches. And so,
I didn't think that.
I thought we had a conversation.
Yeah, I thought that they did. I keep being told that our regulations do cover it.
no, I checked with Cheryl Sabaro, and she said that no, your regulations do not cover it because it is made from synthetic nicotine.
Okay. So we need to add that wording.
So we need to just slightly change the wording of our existing tobacco regulation. And Cheryl Sabaro is very happy to and supplied us with just a few words to insert into our current regulation that'll fix that problem. There were some people who already sent some rather negative emails about that, who are part of the the industry and the companies that do supply these things. I asked some people who have gone into do tobacco inspections if they have actually seen those things, and in several cases, they said the owners of the tobacco stores said they don't sell it.
I don't know where you can sit them, so.
But I think it's widely available and our students are using them.
They make key punches?
Yes.
Yeah.
I know Erin said that she thinks that was a significant problem among some high school students. I assume it's not just Plymouth itself, I assume that it's also Plymouth. Is that true as far as you know?
Yeah,
Because the amount of nicotine in those things can be astounding. It is one of those pouches that have as much nicotine in it.
Ugh. Ugh.
Very, very concentrated, and it certainly is going to get people addicted to nicotine. And some people actually put more than one of those pouches under their tongues at the same time.
Does that affect their heart rate?
It can. It is actually dangerous from that perspective. too.
Yeah.
I mean, it is possible to overdose on nicotine. And there's some very drastic health consequences to that. It's a serious problem. And I'll show you next time when we have the public forum. I saved it for that. There's about 40 different kinds of flavors that those things come in,
You can't sell the flavors.
but they can sell the pouches.
They can sell the punches, but you can't sell.
Can be
flavors.
flavored, yeah.
But I have to check with Sheriff's Bar about that too, to make
Yeah,
sure that's true.
I'm surprised because I've been told that is covered and maybe it's a new realization that it's not covered, but,
Well, I'm sure I could
Yeah.
convince Sheriff's Bar to join in on
no,
our
I
public forum.
definitely, I was emailing with Cheryl today, so I'm sure that she's available to answer that question.
So it may be specific to our particular regulation, because we didn't say anything about synthetic.
Maybe.
Maybe the state regulation that followed actually after we put one in place does. But it's certainly worth checking on.
Yeah. The other thing about the, tobacco regulations we had talked about was the fining structure. And then so what do we, in our regulations, do we have that it's 1,000, 2,000, 3,000 for local policy too? Or do we have something?
I think Cheryl went over that with me also, but
Okay, because I know.
our regulation actually says, any food establishment violates any provision of this regulation as established by the Board of Health shall be liable for a fine as follows. First offense warning, second offense and subsequent offenses. Yeah, that's the firefighter. No, I mixed that up with the other one. I don't hit the other one because we usually do that in
Okay, I guess, I know that if there's a state law that says for the local policies, which would be like blunt wrap,
Yeah.
you can't fine more than $1,000.
Right,
Some towns, I know in Mansfield, you had 1,000, 2,000, 3,000 for any violation. And that was in contrast to the state law that says you can only have 1,000. And I forget what we have here in Plymouth, if we have 1,000, 2,000, 3,000 for anything.
I think it's 1,000, 2,000, 5,000.
Oh, 5,000, you're right, but you can't do that. So you can, for local policy, you can't go, you can do 1,000, 1,000, 1,000 for first, second, and third, but you can't do anything over 1,000 because it's within a state law that says you can't. The only thing you can find for more than 1,000 is what the state law says.
So selling under 21.
And they have a whole, in the model regs, they have a whole, list of state versus local policies in the most recent model regs. So that's, I think, like I said, I forget what we have in mind, but it might be something that we need to, adjust if we are saying that we would find more than 1,000 for a local policy.
Well, we are finding the state mandated fines.
For state law.
But that's under state law, but it's also in our regulations, because we are required to fine according to the state guidelines.
Right, and so that is, And Karen, jump in, because I bet you know what I'm trying to say.
Yeah, I do.
Struggle.
Yeah, and I'm looking it up right now, so we can see.
Yeah, so what? I can find the model regs. Is that what you're looking for?
Yeah. Okay, so,
But Carol looked at the regulation we had and said nothing about anything that was incorrect in it.
Yeah, I'm surprised because, so I mean, we could be all set, like it could be fine,
so it's 1,000, 2,000,
yeah.
5,000 on everything.
So I was told
That we can't go over 1,000.
1,000 for the local, and when I just did the model where it looks like the MHD only has the 23 ones. Online, it doesn't make sense.
So give me an idea, Amy, of what would be ours, but not the state's.
Well, I think the state refers to underage sales. Does it not?
Only?
Because that's what we've been doing, it's the underage sale violation.
Right, but we have others. We have other things too. I mean, we have no tobacco under 21, we have tobacco product sales permits, we have, retail density, meaning the 300, you can't build another, you can't sell, 300.
Let's. These are based on model regulations, so you would see, so here, it's the fine 1,000 for state law and $500 for local policy violation, and then they give you this, the model regs give us this list, so policy subject to state law, tobacco and vape sales, flavored tobacco, penalties to sales under 21, ban on free distribution, ban on self-service, so those are all within the state law, but nicotine-free generation, that could be local, prohibition of the sale of blunt wraps, ban on smoking bars, cigar sales regulating, including minimum sales tax. So these are.
Those are local.
Yeah, local.
And that's included that's included for 1,000, 2,000, 5,000.
So I was told
Okay.
that we can't do that.
So we need to pull those out.
We need to do, and then model the 24, 25 model regs, is that where we're at now? The most recent model regs say how to write them. Around the finding.
I will consult Cheryl.
Yeah.
As to whether or not we need to pull the local regs that are not part of the state regs for separate local only towns.
No, you can do it within, I mean, the model regs give you, like, you can say, 1,000 for state and 500 for local. Like,
Yeah, we can still have it all be in the same regulation. However, the finding has to be different, meaning like these violations result in these fines. These violations result in these fines.
And like I said, with even adding just the lists to
Yeah.
the regulations helps me, remind myself.
Okay.
What isn't, but.
All right, so you're gonna check with Cheryl. Okay, yeah, but Amy, I know exactly what you're saying. Yeah.
Welcome to the expert on that.
It took me a while to know, and then I was told that that's.
Okay. So, and there it is. There's the defining factor is you can't go over $1,000.
Yes, that's the state law.
Well, to be honest, up to this point, we have only fined 4 underage.
Right.
So we haven't, yeah, which is good news. And I haven't received anything lately from Bob, so.
That's twice a year, unless there's a.
But it seems like it might be time again.
Yeah, I know that the Bob Platt doing the inspections for the non-coalition members. He just completed another set of inspections in December.
Okay.
Because we wanted to make sure we paid him out of our.
Yeah, the other year. Yeah, okay.
Anyway, that's, I believe all I have. So the next meeting will be on the 5th of March. And before that happens, I will consult Cheryl Savaro and bring to make sure everybody gets a copy of any revisions we have to make on our existing regulations. Aside from trying to make sure that it covers pouches.
Yeah.
The guy tells me that Massachusetts is regulating oral nicotine Yeah, I was saying it then. A quick Google search, we're good.
Okay,
Let's not bet the farm on that.
so the next thing I'd like to do, is just go to our student representatives and anybody else for that matter, and find out if anybody has anything that I think is suitable and would like included on future agendas as additional items.
I think my big thing was the nicotine patches, but we talked about that. So that was my big thing because I've just noticed more kids are doing it. So
Okay, so if if you come up with any other ideas, and that's for you too, Madison, so let us know what you think. I encourage discussions like this to go on in some of your classroom settings. And as a matter of fact, I think, Karen suggested that it might be worth our while after we take care of the public forum on tobacco regulation to actually schedule a public forum specifically aimed at high school students with interest in public health. And so we can do that. We have the ability to do that, especially once the town meeting is over, so we can get a room.
Yeah, April 5th will be a town meeting.
So, what I can do is I can try to get people from the state DPH to zoom in or come in person to do a presentation about job opportunities in the public health field. And to answer any questions anybody has. And since you both seem to be attending, I know you're shaking your head because of what's happening in the federal level is a bit of an issue. But if you could ask students in your classes that you attend, if they would be interested in attending and see if you get a number, because it can also be, by Zoom or in person. But we will schedule that for specifically high school students if there's enough interest so that it warrants it. So we appreciate your help in trying to do a little bit of search. And of course, your high school instructors would also be invited to attend as well, as might also the school principals.
Yeah, because I've done a couple of things with the health teachers too, so we might want to talk to them.
And, obviously Carolyn Rains, who's the head nurse of the school system, would probably be present as well. So we could make it quite a group. If there's enough interest for us to do it, we'll do it. So aside from that, is there anything else that anybody else would like to have considered for our agenda? Should think of at the moment. I keep my eyes on the internet all the time, looking for thoughts. But apparently, this Board of Health is rather unique in that we are covering a fairly wide range of topics. For those who used to go to Board of Health meetings years ago.
Yep.
It was almost exclusively Title V variance requests.
That's a big difference. Well, don't forget too, I mean, our division was under an inspectional services model. So everything was around that, but no, it's a whole new day here.
And everyone should have gotten an email from me about the MAHB certification meeting, which is going to be at the 1620, so it's nice and close. Those that don't have to go to town meetings on that day. I even asked if they could change it, and no, it's too late. It's already, everything is booked. There's a contract with the hotel and
Just ironic that the day that something is held in Plymouth. It's yes.
Not a one-time thing.
Oh, I know. It's just
they enter into a contract with a hotel chain.
I'm going to try, I think, pretty soon. I'm gonna do Title V, yeah.
We have replaced Taunton for the MAHB certificate meeting for an indefinite number of years. Assuming everything goes well this time and they like it, maybe. I'm pretty sure that they will. So all we need now, unless there's something else, anybody, I think we're doing. Okay, any discussion? Okay, Lorenzo, yes or no? Motion to adjourn.
Yes.
Amy? Yes. Thank you all, especially thank you to the two students that joined us.